As Canada's population ages and chronic disease rates increase, seniors are facing a shortage of health and social services in French. With more than 200,000 Canadians aged 65 and over living in French-language minority communities, ensuring access to health services in French has become a priority. Recognizing the importance of working together to find a solution, 4 organizations joined forces during a day-long seminar to discuss the issue in November 2018. They are the Société Santé en français, the Groupe de recherche sur la formation et les pratiques en santé et services sociaux en contexte francophone minoritaire, also known as GREFOPS, Fédération des aînés et aînées francophones du Canada, and ARIMA. At the end of the event, all 80 participants agreed that improving access would require influencing public policies that affect seniors. To support this goal, they shared a joint position statement and presented it in a position paper entitled Joining Forces for Active Offer of Integrated Health Services to Seniors in Official Language Minority Communities. The document is a calling card that aims to rally partners and decision makers around the vision shared by the various organizations working in this field. This video is a complementary tool that provides a more detailed explanation of the ideas set out in the position paper, including the key messages and the notion of shared responsibility. We will also provide suggestions on how to use the document to support a joint effort on improving access to health and social services in French for Francophone seniors in Canada. The position paper calls for shared responsibility between the various system stakeholders and outlines the commitments needed from them in order for all parties to work together toward this common objective. The first shared responsibility is to develop a common vision to ensure the delivery of integrated health services that are safe, of high quality, and culturally and linguistically appropriate. We also wish to mobilize key stakeholders, including the Anglophone and Francophone partners, to meet the specific needs of the aging community. Finally, it is crucial to promote collaborative leadership in planning French language care and services for Francophone seniors in French language minority communities. The position paper then lists 5 key messages that should be acted on in order to improve access to health and social services in French for Francophone seniors in Canada. Health and social service professionals who speak French are not always easy to identify, nor are they always employed in positions that put them in contact with seniors in French language minority communities. Therefore, various strategies are required to attract and retain French-speaking professionals in positions that involve serving this population. For example, it is possible to raise awareness among professionals during their initial training programs and professional development courses about the challenges faced by seniors in French language minority communities and their needs. It is also possible to provide internships in French language minority communities to students enrolled in programs offered in French and to bilingual students enrolled in programs offered in English. Also, it's possible to find innovative solutions to help health and social services organizations recruit bilingual workers for bilingual positions. We can also recognize the efforts made by bilingual staff so that they perceive bilingualism as an asset and not as a burden. Work has already been carried out to help organizations implement some of these strategies. For example, there is the online resource called Health Human Resources Strategy, as well as handbooks describing clinical internship opportunities for students registered in programs offered in English as part of a study conducted at the University of Ottawa.
When I teach the principles of active offer of French services to future professionals, I can see their interest increase towards French language services. Our students from programs offered in French realize that it is not always easy to have access to services in its preferred language, and they become more aware of the consequences of not receiving such services. The training boosts their pride of being able to offer services in French. We have also offered internship in French to bilingual students from programs offered in English. At post-placement evaluation, all participants mentioned increased confidence in their capacity to offer French language services. I hope that, when working in the health and social sector, these professionals will more spontaneously identify themselves as being bilingual than if they didn't have these training experiences. I provided only a few examples of how we can value our bilingual human resources to raise availability of French language services. I wish you can find others in your own settings.
Reducing health risks is a top priority in care and service centers. Making the connection between language of service and health risks creates a strong argument for promoting improved access to services in French. The risk of medical error or suboptimal care is higher when communication is inadequate.
Studies have shown that Francophones living in a minority context in Canada are less likely to access services if they feel they will be exposed to a linguistic barrier. For these patients, health problems may persist. For those who do access services, their linguistic insecurity may lead to poor explanation of their health problem or a poor understanding of the proposed treatment. For this reason, not only is the patient at greater risk, but also the healthcare providers and the health systems, because they cannot provide safe and secure care for all of their patients.
Promoting a collaborative approach requires involving Francophone and Anglophone leaders, as well as communities, professionals, and patients, to propose changes and leverage the strengths of each group of stakeholders. Examples of collaborative practices are available in the Handbook of Innovative Practices on the GRIFOPS website.
Hello. For me, this key message brings me to reflect that if we want to change our ways of doing things and have an open mind, it is important for experts as well as members of the community to work together so that they can understand the different points of views around a specific situation and then move towards a common solution that meets the needs of the majority of that community. However, for this to occur, individuals need to get involved for the health and wellness of their community. Together, innovative work is accomplished.
The lack of linguistically appropriate services has a serious impact on seniors. Therefore, it is important to involve seniors as part of the previously mentioned collaborative process in order to find solutions that address their needs in terms of access to services in their language. Not all seniors have the same needs, and their needs change as they get older. This is why it is important to include seniors and their caretakers in discussions on how to improve care and services for this population. This would align the process more closely with the patient-partner approach and the patient-centered care and service delivery approach. In order to engage and involve seniors, we require relevant information that is tailored to their needs. The Ottawa Region chapter of the Fédération des aînés et retraités francophones de l'Ontario has developed a pamphlet for local seniors summarizing research findings on access to social services and healthcare in French and on the coordination of these services. The pamphlet also provides concrete recommendations to help increase demand for services in French and foster involvement in the community.
It is essential that Francophone seniors be consulted about different programs and care environments. In addition, user committees and services dealing with patient experiences, including the language factor, contribute to improve the quality and security of care. That way, the satisfaction of users is also enhanced.
Since decisions are often affected by budget constraints, additional data is needed on the economic advantages of receiving services in one's native language. This data could help justify the need for access to services in French. If language data collection and accessibility is made a priority, it will be possible to measure and prove the economic impact of providing seniors with services in French. To demonstrate that improvements are required, what we need is concrete evidence that health and well-being is improved, medical errors are reduced, and adherence to treatment is increased when patients receive services in their language. To quote Charles Gagné, Executive Director of Action Marguerite in Manitoba, "Increasingly, we are coming to the realization that active offer and service in French result in better and more cost-effective care and services. We recognize that our interventions and the language of communication we use with elderly patients are part of a client-centered service delivery model, which is associated with time savings, more effective resource management, and especially greater satisfaction and improved quality of life among vulnerable people." Now that we have a better understanding of the key messages, here are a few ideas on how to use the position paper to promote action and to engage partners in a joint effort to improve seniors' access to healthcare and services in French. In order to truly influence the development of public policies, the position paper should be used as a calling card and distributed to decision makers and our partners. The position paper can be used to help organizations set priorities and to convince and involve partners. To this end, the position paper can easily be used as a reference document at representations with stakeholders or public consultations. It can also be included in funding requests or research grant applications. It can be sent to provincial or territorial decision-making bodies, including health boards, authorities, or government departments, as well as departments dealing with social services, senior services, and Francophone affairs. Do you believe that it is important to improve access to health and social services in French for Francophone seniors in Canada? This document can help. It's a valuable tool for raising awareness of the issues affecting your community and mobilizing decision makers and your partners to support the cause. Use it. Share it.